As I pursue my license for therapy, something that comes up often is this concept of traditional therapy versus psychedelic therapy. But I think we've been using the word tradition all wrong. Most therapists refer to what they do as traditional therapy. But every time I hear that phrase, again, something in me just questions it. Because when we really look at the history of healing or human evolution, which I prefer, what we call traditional is actually very new. And what we call alternative is actually ancient or traditional, right? Talk therapy, CBT, psychodynamics, psychoanalysis, it's about 130 years old. It began with Freud, in a room with a couch and a notebook, introducing this idea that talking about our problem heals them. And don't get me wrong, there's nothing wrong with talk therapy. It has value, it helps people, that's beautiful. But also, let's stay honest. Talk therapy is traditional to institutions, not humanity. So long before couches and clipboards, long before diagnosis codes and insurance billings and all of this, humans were healing with psilocybin, ayahuasca, peyote, iboga, cannabis, breathwork, drums, altered states, community, ritual, and the list goes on. But not centuries ago, tens of thousands of years ago, across cultures, across continents, across human history. Entheogens weren't alternative. They were the medicine. Ceremony wasn't unconventional, right? It was the healing container. Community wasn't group therapy. It was how we remembered who we were. So here's my truth, or the truth as I see it. Entheogens are traditional to humanity. Talk therapy, or what we call traditional talk therapy, is traditional to the institution. One works with the mind, the other transforms the self. One's analyzing the story, the other liberates the storyteller from what they identify as. How many times have you heard, one psilocybin or one entheogenic journey helped me more than years of therapy? It did for me. And it's not because psychedelics are magic, so let's understand that. But it's because talk therapy works with cognition. Psychedelics work with consciousness. Talk therapy tries to understand trauma. Entheogens help you release it. Talk therapy helps you describe who you think you are. Entheogens help you remember who you've always been. We aren't bringing psychedelics into mental health. We are returning mental health to where healing has always lived. This isn't a new model. It's the original model. So I guess in closing, my perception or perspective is talk therapy is traditional to institutions. Entheogens are traditional to humanity.